Hi, I'm Dr. Professor Alex Rhema Zachariah, MD. This is our continuing series on what's new in wellness and health. The expert speaks. And today we have Dr. Douglas J. Jones, MD, Christie Clinic board certified general surgeon. And Dr. Jones, how long you have been with Christie Clinic?
I've been with Christie Clinic now since August of 2003, so it's been a little over 9 years.
Very good. And when did you start planning to have robotic assisted surgery? Because this is primarily a gynae area for this robotic surgery.
They actually just released it officially this year, but one of their sales reps told me about it last year, and that's when it crossed my mind that I really wanted to be one of the first, if not the first person in this area to offer it.
Yes, and you certainly are the first one. You are the pioneer in this particular surgery, which we will be hearing more about it soon in this part of the area. So keep listening, and we have something very exciting coming up. Now, Dr. Douglas, where did you do your undergraduate or your MD?
Well, I did my MD at Morehouse School of Medicine. It's in Atlanta, Georgia.
Yes, very famous.
Yeah, it's a good school, very good school. Historically black university undergrad.
Yes, that's why it has a long history and University of Excellence.
Correct.
It has produced some wonderful graduates. And,
people like Martin Luther King Jr., Thurgood Marshall have all gone through there, so it's a very good school.
I was the dean of one of the top medical school in India, and this was one of the school I admired, and I keep reviewing it. So I was delighted to know that you're a graduate. Yes, after that, when did you do your board certificate?
I did my actual residency training at Cleveland Clinic.
Cleveland?
Cleveland Clinic is one of those big hospitals.
Yes.
Always ranked as one of the best hospitals in the country. Usually going head to head with Mayo Clinic and all of those guys. So spent 5 years there before coming here. Yes,
and you did your board, your fellowship, your residency and fellowship?
I actually did not do a fellowship, but I did my whole residency there.
That's good enough. Okay, and after that, you were in the U.S. Infantry?
Yes. That's actually is funny. I went into that to get money for school after my freshman year. I had everything paid for my freshman year.
Yes.
And I lost some of my aid packet. But the main thing about that is it ended up being a great experience for me because I got to be part of the 3rd U.S. Infantry, the Old Guard. Presidential jobs. I served under the first President Bush, and I got to do White House ceremonies, and I also spent about a month at the Tomb of the Unknown Soldier.
That's a very memorable time.
Yeah. It's actually, now that I'm further away from it and I'm a little older, I realize just how big of an honor it was. So,
absolutely.
A lot of people come up and thank me for that service. So.
I was particularly interested in the former guard of the Tomb of the Unknown Soldier. And as we know, thousands and thousands of young people have sacrificed their life for our freedom. So they gave their todays for our tomorrows.
Correct.
And how long you do this guard? For 8 hours or a few? What length of time?
Well, actually, there are 3 separate reliefs. And what we do is one relief will work for 24 hours, and then you get 48 hours off.
Yes.
Okay, so during the summertime, one soldier will actually be at the tomb out there walking on the mat for an hour.
Yes.
And then they would change.
Yes.
And during the wintertime, move it down to 30 minutes because it's a lot warmer. I mean, a lot colder, and it's a little harder to stay out there for that long.
I salute you for this kind of very special experience you had. I don't think many physicians have this experience.
Yeah,
so
I can't imagine too many have either. It's not a lot of people who got to walk on
absolutely. So, to guard the president and also guard the Tomb of the Unknown Soldier. All right, so we have come to this new procedure that we are talking about, Dr. Jones, which you are the pioneer in this part of the world. And would you tell us something about it?
Well, as you know, gallbladder problems are one of the more prevalent things we have to deal with as surgeons, especially surgeons of the GI tract.
Yes.
And initially, During the operation, it required a rather large incision on
Yes.
the upper part of the right
Yes.
abdomen. And in the 80s, it sort of developed that we could do this laparoscopically with 4 little incisions.
Yes.
And that has been the standard of care.
Yes.
And it still is in a large degree. But however, now we have a way of doing this through one tiny incision,
Yes.
actually through the belly button itself.
Yes.
And that alleviates the other 3 incisions. So in that regards, it's actually a great operation. As a professional, I would tell most people who are out there in our audience that taking the gallbladder out traditional laparoscopically and using the robot through a single incision, the actual what word would I like to use here? You're going to have to cut this out. The actual benefit of having the operation is the same between the two.
Yes.
However, cosmetically, it's a lot better to only have the one tiny incision that's right in the umbilicus. So the reason it's such a good operation for me and I feel so good about it is almost like I feel I'm doing a little plastic surgery, still taking care of a regular general surgery problem, in that people get to leave and basically everybody is like, you didn't have your gallbladder out, because they don't see the normal incisions.
That's
and
right.
It's kind of a good feeling to know that a lot of our younger people or
Yes.
even the older people who are very concerned about any scars on their belly, get to keep that part of their belly
Yes.
looking
Good.
like it's never had an operation
Never
before.
had an operation. What is the burden of gallbladder disease in United States?
Well, it's rather prevalent. I've read that you can have up to 800,000 new cases diagnosed a year just in the United States alone. And it has a variety of symptoms. Mostly people have problems eating greasy foods or fatty
Yes.
foods, or
Yes.
sometimes even onions, tomato-based products. Ingestion of alcohol gives
Yes.
a bloated feeling, nauseated, pain in the upper abdomen,
Yes.
and it's rather debilitating. I have some people, as soon as they have the symptoms, they get diagnosed and they get it taken care of. But I've met patients who told me they've been dealing with this for like 20 to 30 years. So I
Yes.
feel very good being able to help people who've been having problems so long.
So this June 15th, you and your team performed this first Da Vinci single-site cholecystectomy. Now, Da Vinci, as you know, is Da Vinci. Why did that name is attached to this?
Well, actually, this technology was initially developed by the military.
Yes.
The thought was to try to enable surgeons to operate further away from the battlefield,
Yes.
and to have a robot to actually do this. Well, it's been rather difficult to use it in that environment.
Yes.
And the actual technology was purchased by, I believe he's a physician/engineer, but he
Yes.
was able to develop it and use it more within the actual society at large instead of the military.
Yes.
Well, most people who have any kind of engineering background are,
Yes.
fans of Da Vinci, and that's
Yes.
kind of how the name got associated with the robot.
Very good. And can we see the video now in which you had
yes,
you
yes.
had that you and the team is performing, and some details?
Yeah.
And so we'll take a break for the video.
Surgery to remove the gallbladder through one small incision in your belly button would be a major breakthrough, and that breakthrough has arrived. State-of-the-art Da Vinci surgery using single-site technology. Da Vinci is minimally invasive robotic surgery that allows your surgeon to operate with 3D HD visualization and smaller, more precise movements through one belly button incision. To perform this procedure, your surgeon first gently clamps the gallbladder. Then, the cystic duct is carefully cut. Next, the gallbladder is freed from the liver, and finally, it's removed from the patient's body. The belly button incision is small and recovery is short. The end result for the patient? Virtually scar-free surgery.
Now that we have seen the video, could you highlight some of the points for those who are watching?
As the video was going on, you had a chance to actually hear the narrator. But the big thing is That single site trocar, that initial trocar that was placed into the belly, is designed in such a way to let all 4 instruments enter in one location. And that's key. And when we're doing this operation, there were times where people tried to do laparoscopic operations through one incision before. But when you do it as a human, holding the camera and holding all the instruments, it's extremely difficult to keep the camera still and to get a sharp image and to actually perform the operation without getting into each other's way. The robot is very instrumental in us being able to perform this operation, keeping the camera still without any movement and allowing all the instruments to work independently. And then we can safely perform this operation without getting into any kind of problems from having everybody crowded and all close together and all the instruments actually, for a better sense of terms, banging into each other.
Yes. And where did you learn this very specialized technique?
Initially, I had to learn just to do what we call multi-port robotic surgeries.
Yes.
And that was learned down in Florida. They have their own special lab, Intuitive Surgical does. And then I was proctored by one of the surgeons in Peoria. And then I did cases at the hospital here in town. And then, well, I should say at Provena Covenant Medical Center.
Yes.
Now known as Presence Covenant Medical Center.
Yes.
And then after that, I went back to Florida to learn the single site, and then I brought it back. The good thing that's going on now for this community is in Illinois, outside of Chicago, I am now the leading surgeon for this operation. So the only way to go to somebody who has more experience than I do with this operation, you would have to go to Chicago. So even my proctor who trained me how to do the operations, I've recently done more than he has. So we're the 2 big downstate Illinois surgeons for this operation.
Congratulations, and this is very important. And so you, tell me something, or tell us something about, you are a Christie Clinic general surgeon, you're operating in Provena.
Correct. So actually, as a Christie Clinic surgeon, I'm able to operate at both hospitals.
Yes.
But definitely, majority of our operations are done at Presence Covenant Medical Center, the old Provena Covenant Medical Center. And they have worked with me very well on this robot. They have got me all the equipment I need, things of that nature. So we work in close conjunction, and I do other operations there, of course. But the big one, because it's the one that's kind of leading the way right now, is the single-site Da Vinci robot.
As the former Chief Medical Officer of Provena United Samaritan Medical Center, I'm delighted for this wonderful arrangement. And if someone who wants to get a surgery from you, how long is the wait period?
Well, actually, it all depends on how you're feeling and how you're doing. I have accommodated patients who've come into my office, and if they needed it, we were able to get them in the same day or the next day. But a typical routine operation where we don't have to go any sooner, we definitely can get you in usually within a week or 2.
Yes, I would rather say a week or 2, because now the word is getting around. And they can see there's no incision. And so therefore, you combine cosmetic surgery with the gallbladder all in 2 in 1.
That's what I feel like is going on.
Yes.
And that's why I'm so happy about this operation, because I feel that, you know, in the future, people are going to really question whether or not the patient has had the gallbladder out. You know, the clips I even used during this operation are actually made out of a plastic material instead of a metal material.
Yes.
And because of that, when they go to get their x-rays, they're not going to see any metal clips.
Yes.
So some of the people are going to question, you definitely never had your gallbladder out. So it's almost like I'm being kind of sneaky, a little magical with it. So that's a good thing.
That is not only good, that is excellent. And there is minimal pain.
I think the pain is slightly better than when we do the 4 ports.
Yes.
But it's still some pain there. But you know, I give you the appropriate medications, and it'll make it a little better.
And you know, the umbilicus, a lot of complex And it's, the sensory nerve endings are too many around umbilicus.
Yeah.
So therefore, that explains why you have pain at all.
Yeah. Well, it's still an operation. Any operation that's done in the belly, because you use your muscles and your abdomen for everything, whether you cough, whether you stand up, walking, lifting things. So you always feel it whenever you do stuff like that. But most people, by the time they come back and see me, I usually do my follow-up operations in about 2 weeks. So by the time they come back, they're doing very well.
And very little blood loss?
Yeah, very little blood loss, actually. It's no different than when we do it with the 4 ports laparoscopically. And usually my blood loss is, so most people know what's going on, is about a tablespoon or less. And that's for an operation, especially going on in the belly, that's extremely low. So usually it's around that or less.
Yes. Now, well, that's what we see. How about when you remove the gallbladder, the on the side blood loss? Not much.
Yeah.
There would not be much blood loss from where you remove the gallbladder.
No, it would not be much.
Because when you look and see, there is no bleeding.
Yes, correct.
I mean, that part of the routine procedure.
Correct.
But it is important for you to know that the surgeon always makes sure that that there is no bleeding at the site where there is operated, other than a little bit of oozing.
Correct.
Right. And recovery?
Recovery is usually extremely well. By the time people come back and see me in 2 weeks, they're ready to resume all their normal activities. I have some patients who come to me who are policemen, firefighters, things like that, and I typically would not let them go back for 4 weeks just to make sure they're safe on the job.
That's right. And so they need to be in the hospital 24 hours or less.
They actually, almost all of my patients get to go home the same day.
Same day. And the total procedure is how long?
For the single site, it normally takes me about 1 hour and 15 minutes.
Yes.
Sometimes it's down to an hour, but usually about 1 hour and 15 minutes, and then you get to go home the same day.
And they come and stay in the recovery room for a while?
Yeah. Normally the way the day goes is they will come into the hospital anywhere from about 2 hours, hour and a half before the operation is scheduled. They'll go through and get all their IVs and get everything they need done. Then they have the operation. Afterwards, spend an hour in what we call the post-anesthesia care unit, the PACU.
Yes.
And then after the hour in the PACU, they'll go to what we call the ambulatory care unit. And usually after about an hour there, they're free to go home after that.
So all this is highly streamlined.
Highly streamlined.
And having worked in Provena Hospital, I know it is.
Yes.
And it is very well done. It's done with compassion.
Correct.
And the real care and the real feeling for the patient.
Correct.
And so all these put together, there is need to be very little anxiety from the part of the person who is going to undergoing. Do you spend some time with them beforehand explaining?
Yes, I do. Yes, I do. And that's usually in my office. And you made a good point about the anxiety.
Yes.
A lot of patients have been dealing with these kind of pains, even when they know it's the gallbladder.
Yes.
Several years. And it's, pretty fearful of having an operation or just not wanting a part of their body removed.
Yes.
But I would say most patients, almost all patients, when they truly have gallbladder problems, when they have it out, the first thing they would tell me when they come see me is they wish they'd have done it sooner. That's almost a universal statement when they come back, especially the ones who've been dealing with it for 5, 10, 15, even 20, 30 years. The first thing out their mouth is, if I'd have known it was going to be like this, I would have done it much sooner.
You mean to say, I thought I come from India, there only people wait this long. People even postpone it for 20 years?
Yes.
That's sad.
Well, it's human nature. It's a fear of the unknown.
Yes.
And the fear of the unknown will drive you to do things that, that we as medical providers, we can think is a little irrational, but I can understand their point. They're afraid, but, when it gets to the point they can't tolerate it anymore, they'll have it done. But then they wish, instead of going through all that pain, all that discomfort, or all those problems, I wish I would have done it much sooner, so I could, felt a lot better.
So would you again reassure those who are hearing that if they have pain and diagnosed as gallbladder, problem that needs a cholecystectomy, they need not wait. So it's that important.
Yes, that would be my recommendation, that waiting is not something you need to do.
Yes.
As a medical provider, I definitely would tell you any operation there is a risk. There's a risk, but if it's easier on me, then that means it's easier on you. And coming in when your problems first start, it's less likely to be very inflamed.
Yes.
It's less likely to have any what we call adhesions around them and things like that.
Yes.
And if that makes it easier on me, makes it easier on you.
Yes.
It's less likely we will have to do, what we call a conversion and things of that nature. So I definitely recommend, come in earlier than later, because for almost all people, it's not going to really get better.
Yes.
There are a few instances, but those are kind of, the minority.
Yes.
Where it might get better, but it usually worsens. So if it's going to worsen, why go through all the increased pain or the increased complications? Because, one of the things from having gallstones particularly is you can develop gallstone pancreatitis.
Yes.
And as you know, that's a
Yes.
very bad diagnosis.
Yes, yes.
It can be almost benign, meaning not cause any problems, and then it can be bad enough you have to go to the ICU.
Yes.
You're very sick.
Yes.
And, I mean, extremely sick. So,
It is very important.
Yes.
So therefore, this needs to be kept in mind. As a medical oncologist, and how often you come across carcinoma in situ, and explain that.
Unfortunately, I've dealt with gallbladder carcinoma or even carcinoma in situ of the gallbladder a little more often than I thought I would. Over the last 2 or 3 years, I probably had 3 or 4 of these actual cancers. So I usually tell patients, because unfortunately patients who have rather large gallstones are the ones that are at increased risk for this, especially. So if you have known gallstones and you're starting to get about 2 centimeters or more, you're really, really putting yourself at a little increased risk. So it'll probably be worth your while to get that taken care of.
Isn't that another reason to get this out sooner than later?
Yes. Usually when the gallstones are that large, I tend to tell my patients it's in the best interest to get it out. Sometimes if we find these by what we call accident, whether we're looking for something else, do a CT scan for something else. If a patient has been totally asymptomatic, if they never had any problems, I will let them decide whether or not they want to have it out. But in the case of one that's that large with the increased risk, I really let them know it's in their best interest not to have it stay there too long.
This, what is the role of the robot in this, just briefly?
The role of the robot is basically still the same as what we said. People who do traditional laparoscopic operations, and people like myself who are starting to use the single site, the operation is good. It is equal. It's the cosmesis thing that's better. One thing I will say about using the robot, it makes it much easier to remove the gallbladder when there are large gallstones, because our incision is slightly larger at the strength layer of the abdominal wall. So somebody who has a large gallstone that's like 2 centimeters, when you do a traditional laparoscopic operation, it's rather difficult to get that stone out. Doing it robotically with the single site, it comes out very easily. So in that regards, it's a little easier, especially with the large stones.
Now, we had a wonderful discussion, and I would like you to give some sort of passing thoughts to those who have this disease and who are anxious and who would now have an option to have minimal scar, certainly not visible scar, robotic surgery. You have started pioneering in this part of the world.
Well, what I would say is definitely they're very vague kind of symptoms. I will go through the list because not everybody associates the symptoms that we're talking about with the gallbladder. An actual common complaint is an unexplained back pain. A lot of people who go to chiropractors, a lot of people who go to spine specialists, if you don't find an obvious bony problem or obvious disc problem and it's in the middle of your back, it might be worthwhile to make sure it's not the gallbladder. If you typically are one of the patients whenever you go out to restaurants or if you happen to eat fast food that have an extreme amount of difficulty, you might be dealing with a gallbladder issue.
Yes.
If you're always thinking that you have food poisoning, no matter if you're feeling like you get food poisoning any more than like once a month, I know some people who feel like they have food poisoning 2-3 times a week. That's a common symptom. It's really common symptom. Loose stools after eating fatty foods or spicy foods, that's kind of a gray area.
Yes.
That could be something that we call irritable bowel syndrome, or it could actually be something going on with your gallbladder. Bloated feeling, nausea and vomiting, and pain right underneath the ribs, whether it's on your right side, right in the middle. And for a few people, believe it or not, even though the gallbladder is on the right side, they have the pain on the left side. And that's a whole nother discussion that has to do with embryology when we're developing in our mother's uterus.
Yes.
And gallbladder starts off as a midline organ. And like I said, it's really involved, but that's the reasoning behind that.
Yes.
Correct.
Well, I thank you for this very important, but at the same time that needs information, and we'll be having you, Dr. Jones, again for another topic in the coming days. But today we are indeed delighted to have you with us, and this groundbreaking event of having done the first robotic surgery with tiny incision through the belly. And please, you heard from Dr. Jones, and if you have any of these symptoms, or if you think, see your doctor, confirm it, and don't delay it, get in touch with Dr. Jones. Thank you, Dr. Jones.
Yes.
It's a pleasure.
Pleasure to meet you as well, and sit down and talk to you about this topic.
Thank you.